Member for Prince George Valemount.
Well, thank you very much, Mr. Speaker. And I well remember the 47 hours of debate where this side of the House stood up and opposed the bill. We did it in appropriate ways. We voted against it. I would point out that the member who just got up and spoke did not speak at all to the bill when it was in the legislature. So it's important to set the record straight. For 17 months, we have been calling for an all-hands-on-deck approach, including the return of unvaccinated healthcare workers, to align with the rest of North America in our province. And yet, this NDP government stubbornly refuses and continues to fail in addressing a worsening healthcare crisis. I'll bring this situation to the minister's attention, and he knows well that the doctors at Vernon Jubilee Hospital have actually issued a public warning. And I will quote, "With the planned closure of Vernon's last remaining walk-in clinic, 120 patients per day will now be left with limited options for their primary and urgent care needs." End quote. How on earth can the Premier or this minister possibly defend the NDP's new normal, which includes having no walk-in clinics in Vernon?
Minister of Health.
Thank you very much, Honourable Speaker. And I believe, and I say this respectfully, the member was mistaken. All members of this legislature voted for Bill 36 at second reading in a standing vote. And I don't say that to be critical. I just say that so that we all understand the record. Equally, Honourable Speaker, the official opposition supported the requirement for vaccination. The Leader of the Opposition clearly stated his support for that initiative. Members of this House will note that we were the only jurisdiction to implement that. It was called for by the opposition before we did so, and we were the only jurisdiction to succeed in doing it. Others attempted to. We did it because of the priority we give, and the priority we've given to protect vulnerable people in our province. With respect to Vernon, we continue to work with the walk-in clinic to make a significant and series of offers to that clinic of support. In addition to that, we added an urgent and primary care centre in Vernon, which has seen 77,000 visits since opening. Honourable Speaker, we also have in Vernon a primary care network, and we'll have more opportunity to talk to that on the next supplementary.
Member supplemental.
Well, thank you very much. And the minister completely ignores the fact that under our watch, we actually significantly expanded healthcare capacity, including Polson Tower in Vernon. And under this minister's watch, what we're seeing is him overseeing the closure of clinics and shrinking capacity. And in what has become absolutely routine for this minister, yet another group of emergency room doctors have sent a letter. They have taken the extraordinary step of having the courage to speak up and send letters to this government. They released a public letter warning that the ER cannot manage the overflow of 120 additional patients every single day once the walk-in clinic shuts its doors. Dr. Chris Cunningham, who runs the soon-to-close Sterling Walk-in Clinic, said this week he has been met with total silence from IHA and the Ministry of Health since September. And even worse, despite appealing to the NDP MLA from Vernon Monashee this mid-summer, the doctor's calls have gone unanswered, and I quote, "I have not heard from her since." Wow. So much for being in dialogue and trying to solve the problem. How can the minister, day after day, stand in this chamber and defend the NDP's new normal of a healthcare crisis, which is actually seeing patients finding worse outcomes every single day in this province?
Minister of Health.
Honourable Speaker, to correct the record again, Honourable Speaker, in contact meeting with Dr. Cunningham September 24th, Honourable Speaker. Most recent meeting with doctors at the clinic November the 3rd, Honourable Speaker. As part of the ministry's effort to keep the clinic open, this is the answer to the question, Honourable Speaker and Honourable Member, and I'm happy to do so. We have already offered bridge stabilization funding that was accepted in February and in August for this clinic of a total of $76,000. In addition, the following solutions were outlined and rejected. the longitudinal payment model with a grace period until March 31st, 2024, offered and rejected. Ministry of Health walk-in clinic stabilization contract until March 31st, 2024, offered and rejected. The Shuswap North Okanagan Primary Care Network, which was created by this government, Honourable Speaker. Remember in 2009, they were promised by a previous Minister of Health primary care networks. They delivered none. And Honourable Speaker, the Shuswap North Okanagan Primary Care Network offered a same-day access contract and extended hours. Not us. Something led by the Division of Family Practice with Vernon Physicians. Honourable Speaker, if we want to talk about that, offered and rejected. The stabilization offer is still on the table, Honourable Speaker, and we are going to continue to work to expand healthcare services for people in Vernon. And I'm telling you, the person who's advocating most for that is the member for Vernon Monasheen.